Understand what bias is. Bias is any tendency which prevents unprejudiced consideration of a question. Okay? Basically, you're concerned whether an author is encouraging one outcome or an answer over another. Understand bias can occur at any phase of research, from study design to data collection, as well as the process of analysis and drawing conclusions. As reviewers of literature, we have to consider the degree of which bias prevented proper study design. Okay? We must also consider how bias might influence a study's conclusions and outcomes. Again, it could occur at any phase, from trial planning to trial end, data analysis. Trial planning, we could have pre-trial bias. It could be a flawed study. It could be designed to render an outcome. It could be selection bias. Say systemic reviews. What if the reviewer only selects for inclusion articles that agree with what he wants it to say? Trial implementation, trial during bias, is very common. There could be interviewer bias. There could be recall bias. There could be outcome bias and performance bias. And what do I mean by that? Well, let's take, for example, I want to run an experiment. And I want to test how well, say, a method or a material really works. So I'm going to create and select an appropriate number of patients. My N will be, say, 100. I'm going to perform the procedure or use the material, and I'm going to recall them monthly for a year and track performance. And everything is going along swimmingly. 3 months is great, 5 months is great, 6 months is great, 8 months. Oh, wait. I'm starting to see some negative outcomes. Based on my rating tools, I'm getting some negative results. So I have a dilemma. Do I continue my study for the full year, or do I stop it at 8 months? Do you see where I'm getting here? The biggest problem is the bias after the trial. Citation bias. Okay? We talked about replication, finding articles and research in agreement. What articles are you selecting? But the biggest problem is the inability to control for variability. And what do I mean by that? I mean, we're not, and we have to be aware of confounding. And what confounding is where we suggest an association where one does not exist. Or even worse, a confounding factor masks a true association. So A doesn't necessarily result in B. And what do I really mean by confounding? Well, let's do this. You've all heard the phrase, an apple a day keeps the doctor or dentist away. And if you go ahead and Google different dental websites, many times you'll find images like this, right? A beautiful, healthy set of teeth biting into an apple. I don't know where this association came from, but we're stuck with it. So I want to run an experiment to determine if there's a difference between the number of new cavities in my patients that eat an apple a day versus my patients who only eat an apple a week. And I'm going to pick an N of 50, okay? Good number, sample number. And I'm going to then monitor historically and with records my patients who eat an apple a day versus my patients who eat less than an apple a week, and identify the number of new cavities, say over a 2-year period. So I compare them. So I have to ask, if the mean number of new cavities for those who eat an apple a day is less or smaller than those who eat less than an apple a week, is it fair to conclude that the lower number of cavities can be attributed to eating an apple a day? Or is the confounding factor simply nutrition? A person who's going to eat a piece of fruit a day is probably more likely to eat more servings of vegetables as well. They probably don't eat processed foods. They have a healthier diet and therefore a less cavity-conducing diet.